everyone. Today we're going to be discussing my client's mental health challenges. My client is a white Hispanic 58-year-old male who was married and then divorced after he suffered his first stroke. He has two siblings, one older brother and one younger sister. His brother lives out of the country and heavily relies on his mom and sister who live close by. The client lives in a one-bedroom apartment on the 14th floor. He is not currently using any assistive devices or adaptive equipment in his daily life. His family consistently checks on him, and he has a 24-hour home health aide who consistently communicates with his mother and sister. On his free time, he likes to ride bikes, and when he was younger, he enjoyed playing soccer and spending time with his friends. The client is seeking services due to being diagnosed with anxiety and depression after suffering multiple acute strokes within the last several years. He was also diagnosed with diabetes. He is mod I in dressing tasks, hygiene and grooming, and is supervision with bathing. He is independent in self-feeding. He is no longer responsible for home management tasks such as finances. He can assist with 25 to 50% with IADLs such as cleaning. Additional formal assessments I would use include the mini mental assessment, which is a brief assessment that focuses primarily on mental status and cognitive issues. I would also use the MOCA, which is a brief screening tool used to detect mild cognitive impairment and early signs of dementia. Other assessments that I would use include the Beck's Depression Inventory Questionnaire and the Generalized Anxiety Assessment. My client's routine has changed significantly as he now has 24-hour home health care aide. He can still dress, bathe, engage in hygiene and grooming, and feed himself. However, he does need assistance in the kitchen during meal preparation. He has had fluctuations in his mental health as he has days where he is more calm and alert, and others where he is more aggressive and does not want to listen to anyone, increasing concerns for his safety awareness and actions. He can be more anxious and increases frustration when he is not able to express himself properly and others have difficult time understanding him. Less than half of the time, he's able to identify strategies to maintain stability. A lot of the times, people have to remind him to calm down and breathe. The key social factors include his family and friends, and his environmental factors include his apartment, having a clean and comfortable home to get back to and feel safe to allow a healthy recovery and continuation of care, having the necessary equipment needed to facilitate engagement in occupations. The occupational challenges or goals discussed include increasing independence and participation in meal preparation and leisure activities. As his occupational therapist, I can work towards these goals by creating appropriate goal-directed interventions, such as creating a visual recipe for him to follow while helping his aide in the kitchen, having him recite the safety concerns while using the kitchen, and as for leisure activities, creating a schedule with him and coming up with appropriate activities for him to engage and have social interactions. Interventions that I believe can greatly impact and increase his overall quality of life and occupational performance is engaging and or participating in yoga classes, guided meditations, and exercise regularly, and healthy eating habits. He already enjoys to ride his bike and likes to regularly go on outdoor walks, so being consistent with these activities can help him reduce his anxiety, stress, and overall increase his occupational performance and quality of life. Some ethical and cultural competence principles I feel are necessary to keep in mind as I plan and implement interventions include autonomy, fidelity, dignity, and justice. Providing him and his family with all the resources they need is their right and helping them get the best care for my client. Also, allowing my client to collaborate with me and make choices and decisions on some interventions that they like to participate in and can really increase their performance and participation in occupations. The stakeholders I believe should be involved in interventions include his medical team, such as speech therapist, physical therapist, neurologist, primary care physician, and of course his family and close friends. By including them, it allows me to be open and receive more ideas and suggestions on how to increase his overall well being in all aspects and his quality of life. Having us all be on the same page with his interventions and increase his support system is very important. During my interview, I did feel as though I allowed the client the opportunity to express themselves and be heard, empathizing with what they say and how they feel, providing consistent eye contact and asking them questions that can allow them to reflect and think, and giving them a safe space to share their thoughts. The most significant lesson I have learned is to be there for people you love and your patients when you're working during their highs and you're working with during your highs and lows. Give them those extra 5 minutes to talk to you and listen to them. I've had experiences where some of my patients really opened up to me and shared their stories, and they ended up crying and asking for a hug and saying they really needed this. If I have the ability to stay and the time to talk to them or their daughters and sons, because I work with the elderly population, I do so. Because they really need someone who listens to them and helps them and advocates for them during one of the hardest moments of their life. If you were in a difficult moment, you would want and appreciate someone to sit and listen to you as well. This lesson will shape how I work with individuals with mental illness by looking at the bigger picture and trying to understand them and their needs during these difficult moments. Something else that I really mention to my clients, especially their sons and their daughters, and their caregivers, is that, uh, you know, it's the circle of life. Um, you're born, you're dependent on somebody, you need somebody to be there, um, nurture you, care for you, guide you, and then you grow into your adolescence, you figure out who you are, what you like, what you're interested in, what you want your career to be. um, you meet somebody, you have a family, um, you know you enjoy your life together, and um, you grow old, and the roles reverse. Now you um, as the son and daughter are taking care of your parents, and this can take um, a tremendous toll on you physically and mentally. And this is what the mother of my client has mentioned, that she feels mentally exhausted, emotionally exhausted, um, having to take care of her son in this case, um, is very sad for her as well, having to witness her son go through this really really hard time in these past couple of years, and being able to really sympathize with her and validate her feelings, I think, is extremely important for her, and know that people are there for her and are here to provide her with all the support and and you know all the support that she needs.